there. My name is Dr. May. I'm a neurologist here at the hospital. Your doctor has sent you to me today because he is concerned you may have a concussion. How are you feeling today? Okay, great. So no adverse effects that you know of? Okay. Have you had any trouble sleeping at all? No. Okay. Any dizziness? That's great. So I am going to start with a couple of general health checks. Yes, you just get comfortable and then we will begin. It's not invasive at all, don't worry. No. Okay. Are you comfortable? Good. So I'm just going to unbutton the top two buttons of your shirt. Do you mind? Okay. That's great. I'm just going to have a listen to your heart to begin with. Just breathe normally. Okay. Okay. That's great. And next I'm going to have a listen to your breathing. So every time I ask you to take a breath in, just breathe in through your mouth and out through your nose. Okay. No. In through your nose and out through your mouth. You know, it's been a long day. Okay. And breathe in and out and in and out. Okay. How is that? Do you feel dizzy at all? No? That's great. Okay. If you could just say the words 99 for me 3 times. Okay? Just wait till I'm listening. Okay. 99. Good. 99. Good. 99. Great. Everything sounds very clear to me. Yes. Do you have any history of lung problems? No. Have you ever suffered from asthma? No. Any familial history of lung disease or heart problems? No. Okay. And was that on your father's or your mother's side? Right. Okay. Yes, it is more common in men. Okay. That's no problem. It's nothing to be concerned about particularly. No. Okay. If you could just pop your arm on the table there for me. That's great. I'm just going to take your wrist, if you don't mind. And I'm just going to listen to your heart rate for a moment. Yes, to keep breathing normally? Mm-hmm. You feeling okay? That's great. It was a little bit raised, but sometimes that's just because people are thinking about it and because of the environment. Yes. Nothing that I'd be too concerned about. No. Just going to pop a new cap on the thermometer. Okay, just open your mouth for me. That's great. Just hold it there for a moment. Have you had a raised temperature at all recently? No? Good. Wonderful. Okay, I think we're done. That's great. Absolutely perfect. Okay. I think that's everything with the general health checks. Is there anything you'd like to tell me that you've been concerned about recently? Okay. And how long has that lasted? Just the past couple of days? Okay. So did that coincide with when you hit your head? It did. Okay. Yes, we will bear that in mind, of course. Okay. We will move on to the cranial nerve exam now. It's nothing to be concerned about. I'm just testing your cognitive abilities, just to make sure there's no damage there at all. It's more of a precaution, as it was only a head bump, so you should be okay. Are you allergic to latex at all? No. Good. You're doing really well. Okay. We're going to begin with a taste test. They're all nice, don't worry. So, this is just flavoured syrup. Completely healthy, nothing to be concerned about, and nothing that will cause any adverse effects. Do you have any known allergies at all? Okay. I'm just going to pop this off so it doesn't get in our way. Okay. So, 3 taste tests. I will just pop it on a spoon and then ask you to have a quick taste, okay? Okay. Okay. How's that? Do you have any idea of what it might be? Okay. Citrus. Very well done. Great job. Okay. And next. This one's my favourite. Okay. How's that? Coffee, yes. Who doesn't like coffee? Probably lots of people. Not me, I certainly do. Okay, now lastly, how's that? Yes, it is slightly harder, yes. Cinnamon, well done. Yes, we tend to use just easily recognisable tastes. It is hard because people eat different things and different cultures. But I think those three most people do get. Yes. Yes, have a sip of water. It's quite a strange mix of tastes, I know. Yes. Okay, so now we're just going to do a smell test. I have 3 vials here with different smells in. Yes, they're just scented oils. Okay, and number 1. Big deep breath. Yes, it's spicy. Yes, that one's actually chilly. It's quite difficult to smell. Slightly harder, very well done. Okay. Thirdly, how's that? Lavender, yes. And lastly, bleach, yes. It's quite recognisable, that one. Yes, if people are struggling with the other ones, we tend to go straight to that one. Yes. Okay. Okay. Now we are going to move on to some eye tests. Yes, just simple visual tests. Do you wear contacts at all? Do you wear glasses? Okay. Have you ever failed an eye test? No. That's great. So, we will start with the colorblindness test. I'm just going to hold up this chart and ask you to just simply tell me what colours you see, okay? Try not to second guess yourself. Okay, so this top colour in the corner here. This one here. Okay, and this one here. This one here. Yes, and this bottom one. Okay, so I think you may be slightly colourblind because you were getting the green and the blue slightly confused there. It's quite common though. Yes, nothing to be particularly concerned about unless it's really causing you issues. Okay. Has that been something that you've noticed before? It has. Okay, that's fine. Absolutely fine. So now we're just going to turn to a page on this chart here that has some sentences on it. I would just like you to read the top sentence out for me, and I do ask you to hold it at arm's length, just like that. Okay? Okay, here you go. Okay. That's great. Thank you. Okay, now I'm just going to get a light and have a look to the back of your eye, okay? Do you mind if I just touch your face? Just underneath your eyelid there. Okay. Now, it may be quite bright. Okay. Just that eye. Okay. Just coming up close there to you. Just hold still for me. Okay. And now just the other eye. Just coming up close to that eye. Okay. That's fine. The backs of your eyes look very healthy. Do you have any eye trouble in the evenings or? Okay. Okay, good. Have you noticed any differences in your vision since you banged your head? Okay. So now I'm just going to do a couple more eye tests. You do let me know if your eyes are getting too tired, okay? You're doing a great job. You really are. Okay. So I'm just going to come up close now. This is called the swinging light test, and it's just to see how your pupils are reacting and if your reflexes are correct. Okay. And the other eye. Okay. And if you could just look at the light for me and look at my finger. Now focus on the light. Now my finger. Now focus on the light. Now my finger. And focus on the light. Now my finger. Focus on the light. And now my finger. That's great. Okay. Great job. Looks great. Now, if you could just look straight down the middle here at my nose, okay? And just point to whichever hand you see moving. Okay. Both. Great. Good job. Okay. So now I'm going to ask you to follow the light. It's just what it sounds like. Just follow the light with your eyes only, okay? Just with your eyes, keeping your head still. Okay. Okay. Good job, you're doing really well. I'm just going to move a little faster, okay? And come a little closer. Okay. Good job. Did really well. Your eye's tired now. I bet, yes. Okay. How many fingers am I holding up? Now. 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 Great job. Okay. So, sorry, I'm always losing things in these pockets. I never seem to know which pocket I've put it in. Now we're going to do something called a Pimpric test. Yes, so I will touch you with something soft and then something sharper. You just tell me whether you feel soft or sharp. Yes. This is just to test if you have any nerve damage around your face. Okay. Yes, it won't hurt at all, don't worry. No, be absolutely fine. Okay, so if you just put your hand out, that's soft. And that is sharp. Okay, okay. Just close your eyes for me. Close your eyes. Great. Soft, sharp, soft, sharp, soft, sharp, soft, sharp, 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 soft, sharp, soft, sharp, soft. Great job. Now if you just look up for me. Yes, I'm just going to do it on your neck. You're not tickly, are you? I am sorry. Soft, soft, sharp, sharp, soft, sharp. Wonderful. Great job. All correct and well. Did you feel any numbness at all? Any tingliness? No? Great. Nothing to be concerned about there. Okay, now if you just look straight at me, this bit might feel a bit silly, but everyone has to do it, so don't worry. Okay, I'm just going to ask you to pull some facial expressions just to see how your facial muscles are working, okay? Okay. So, if we could just start with a smile. Yes, just a smile. Great. All your teeth. Wonderful. And if you could puff out your cheeks for me. Great. And if you could frown for me. All the wrinkles. Wonderful. And raise your eyebrows for me. Just raise them. Great. Okay, I'm just going to place my hand on the side of your head. If you could try and turn against the pressure of my hand. Just like that. Great. And other side. Wonderful. And just try and look down. Okay, and try and bring your head back for me. That's great. Okay, now if you just relax your face and look straight at me, I'm going to assess your facial symmetry, okay? Great. So. I'm just going to tap around your eyes to assess your facial structure, okay? That's great. Now I'm just going to feel your sinuses. Any problems with that at all? Any sensitivity? Do you have any sinus problems at all? Okay, great. Now I'm just going to whisper some noises in your ears. You just tell me what it is I'm saying, okay? Okay. Hockey. 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 Correct. Badminton. Badminton. Well done. Chatterbox. Chatterbox. Yes. Kitten. Kitten. Coffee. Coffee. Very good, you're doing a really great job. One last one. Tea. Tea. Wonderful. Okay, now I'm just going to place my hands on your neck. Do you mind? No? Okay, I'm going to put my hands on your neck, and ask you to cough, okay? Okay, and one big cough for me. That's great. And if you could just do a big swallow for me. Wonderful. Everything feels fine there. Do you have any issues when you're eating with swallowing? No. Wonderful. Okay, so now if you could just pop your tongue out for me. I'm just going to have a quick feel, okay? Okay, and if you could just push your tongue into either side of your mouth. Yeah, that side and that side. Great, good job. Okay, that is the final test of the day. You passed with flying colours. No problems at all. No. Yeah, of course you can have some, yeah. Okay. How are you feeling? That was a great job. Yes. Yes, I will report my findings to your doctor and we will be in touch shortly. Okay. It was lovely meeting you. Thank you for coming.